You see people at their most unstable. You have minutes, not hours. And the decisions you make in those minutes shape everything that comes next. This deployment training is for medical first contact personnel, the people who meet crisis before anyone else. ER teams, paramedics, EMTs, nurse practitioners, detox intake staff, crisis stabilization units, hospital social workers. You don't just treat symptoms. You stabilize a moment that could go in 100 different directions. You see overdose, withdrawal, psychosis, trauma, fear, and resistance, sometimes all at once. And in that moment, the patient is not thinking long-term. They're thinking survival. That's why your tone, your words, and your next step matter more than you realize. Most people in crisis don't follow through after they leave your care. Not because they don't want help, but because the moment passes, the fear fades, and the chaos returns. The gap between crisis and care is where we lose them. Before we talk about deployment, you need to know the tool itself. This is Crock Pots Common Sense, the first 90 days, Field Edition. It's a short, simple, non-clinical guide designed specifically for people in crisis. It's written for the first 90 days after crisis, the most unstable, unpredictable, and vulnerable part of recovery. It gives the patient one thing to focus on, one habit to build, and one direction to move toward. It's not a program. It's not a commitment. It's a stabilizer. Hey, I know this moment is heavy. You don't have to figure everything out today. Take this. It's simple, it's honest, and it will help you steady the next few days. Start with the first page when you're ready. The goal is a seamless 20-second handoff that stabilizes the transition. This works because it meets the patient where they are, overwhelmed, scared, and unsure. It gives them something they can control, something they can read privately, something that doesn't judge them, something that doesn't require a perfect decision. It provides a quiet anchor in a loud storm. It gives you a way to extend care beyond the room. It increases follow-through. It reduces recidivism. It builds trust, and it turns a crisis moment into a direction, not a dead end. You are the first contact. You are the stabilizer. You are the one who sees the truth before anyone else. And now you have a tool that helps carry that moment forward. Thank you for what you do. Thank you for staying steady. And thank you for helping people take their first step from crisis to care.